Welcome to the monthly meeting of the Pitt County Board of Health. We'd like to call the meeting to order. I'd like to ask, are there any public comments tonight? Okay, hearing none, we'll go ahead and review the minutes of the previous meeting from the April 14th. Are there any corrections or additions to those minutes?
Move that they be accepted as presented.
Second.
Okay, there's been a move and a second. Any further discussion? All in favor say aye.
Aye.
Any opposed, no. Okay, the minutes are accepted. I'd like to move on to fiscal report. Mr. Reed.
Mr. Chairman, board members, I'll try to keep the report short tonight. I know we have a lot on the agenda, and quite frankly, there's not a lot of surprises or changes in this report from the previous report. You have the April 30th, 2015 report in front of you. We are 10 months into our fiscal year, which will end June 30th. As of April 30th, we brought in $7.3 million of revenue versus about $7.15 million of expenditures, yielding a surplus year-to-date of $191,000. Once we take into account those timing items, which are primarily earned revenue that we just haven't booked yet, some of that revenue is even in-house, that surplus jumps up to about $446,000. And while that is an enviable position to be in this deep into our fiscal year, it does come with a couple of caveats, and one that I've mentioned probably every meeting is that in May we will have that one additional payroll period. That will eat up about $290,000 of that surplus. Additionally, I have seen some rather large purchase requests coming across my desk in the last couple of weeks. Typical year-end expenditures, trying to get some expenditures, things bought before the end of the year. So we're still in a very good position. If I had to estimate, I would certainly say we would not use any of our budgeted fund balance to support operations this year. And I would estimate right now about $175,000 would be added to our fund balance at June 30. And with that, I'll be glad to take any questions.
Thank you, Mr. Reed. Anybody have any questions or comments? Just had one quick question. Have we used much of this $20,000 of the Ebola preparation funding? Or?
We haven't used any of that. We actually have not gotten the agreement addendum from the state. Okay. We anticipate getting that in time to start spending around June 1.
Okay.
So it might be, and I think those Ebola funds go from June 1 to September 30. So that's the time frame we will be spending that.
Okay. I know in our surrounding counties, we've had a few folks who have traveled and either volunteered to work over in one of the affected countries and come back and have to be monitored for a month. So I assume that'd be part of the way that some of those funds are spent, or to do those daily temperature visits and so forth. So, okay. Does anybody have any other questions or comments? Is there a motion to approve the budget as presented?
So moved.
Second. Second. Okay. Any further discussion? All in favor say aye.
Aye.
Any opposed? Okay.
Mr. Chairman, I do have just wanted to update you on the fiscal year 2016 budget. Not a whole lot to report, but Dr. Morrow did present to the Board of Commissioners on Friday our budget request. That was very well received by the Board of Commissioners. They were very complimentary of the programs that the Health Department carries out, and they were also complimentary of our modest request for county funding next year. So it went very well.
Very good, thank you. We'll move on to the new business, State of the County's health report. And we have a whole list of presenters here, so.
Okay, good evening. I'm happy to be able to share with you the State of the County Health Report for 2014, and also happy that we have several of our community partners here with us tonight that are going to share all the great work that's been done over the past year throughout 2014. First, let me give you a little bit of background about SOCH in case you don't remember the why we do it and how often we do it. It is conducted annually, and it's conducted to report activities that are related to the county's community health assessment. And the report contains the most recent secondary data, annual updates on activities that have been implemented to meet health priority goals that are identified in the county's community health assessment. And SOCH report is required by the state. It's also required as part of our accreditation process. Background on the community health assessment. The last assessment was conducted in 2011. Local health departments generally conduct assessments every 4 years. However, we recently moved to a 3-year cycle to partner with our local hospital, the Pitt Medical Center, as they're required to do an assessment every 3 years according to the IRS and the ACA. The next joint assessment is scheduled to be completed in the summer of 2015, and we are working on that right now. Also, to remind you of the 2011 health priority selection areas that we'll be discussing tonight or presenting on tonight. Pitt Partners for Health, which is our local Healthy Carolinians group, our community group that we choose priorities in order to present to the Board of Health and to the hospital board, and then we choose goals or establish goals to carry out this work. So the 2011 priority areas were selected by Pitt Partners for Health, Pitt County Board of Health, and the Pitt Medical Center Foundation based on recommendations from Pitt Partners for Health in 2011. The priority areas: chronic disease control with focus on cardiovascular disease and diabetes. And these are all Board of Health priorities that you selected back in 2011. Risk factor reduction with focus on nutrition, physical activity, and tobacco. Infant mortality and unintended pregnancies. Communicable disease control to include sexually transmitted diseases, infectious diseases, and foodborne illness. Then there were some additional priority areas that were selected. Pitt Partners for Health selected cancer. They also selected injury prevention and violence. And then Pitt Medical Center Community Benefits Foundation selected access to care. And you get to hear about all of the activities related to these priority areas tonight. Every year we look at our leading causes of death, and this secondary data that we collect is also how we choose the priority areas with which we're going to work on. As you can see, in 2013, which is the latest statistics that we have, the leading causes of death were heart disease, followed by cancer, stroke, chronic lower respiratory diseases, diabetes, all other unintentional injuries, Alzheimer's, motor vehicle injuries, kidney disease, influenza and pneumonia, and septicemia. There are actually 11 up here because influenza and pneumonia and septicemia tied for number 10. We also have a breakdown at reasons why people were hospitalized, and this was for Pitt Medical Center in 2013. The number one reason for hospitalization was cardiovascular and circulatory diseases, as you can see the number beside that. Pregnancy and childbirth, that's kind of a given because the majority of individuals do go to the hospital to have their babies. Digestive system diseases, other diagnoses including mental disorders. Number 5 was injuries and poisoning. The report that you have in front of you just shares the 5 leading causes of reasons for hospitalization. However, for this report, I did break it down up to number 10 to show you additional reasons. Number 6 was respiratory disease, breaking down into pneumonia and influenza, COPD, which excludes asthma, and then asthma is broken out as a separate category. Number 7 is infectious and parasitic diseases. Number 8, endocrine and metabolic diseases, and as you can see, diabetes counts for half of that. It's 492 out of the 990. Number 9 was musculoskeletal diseases, and then number 10, the urinary diseases. Now we're going to go into the reports of each of these priority areas, so I'm going to turn it over to Brittany Kinder. And each one of our presenters tonight will introduce themselves as they come up.
Yeah, thank you very much.
Good evening. I'm Brittany Kinder. I'm the health promotion nurse for Pitt County government. And tonight I'm going to focus on the priority area of chronic disease with a focus on cardiovascular disease within Pitt County government and the outreach activities that were conducted in our community in 2014. So, In 2013, heart disease was ranked as the first leading cause of death in Pitt County, with stroke coming in third. And based on that data, the prevention goal that was chosen was to reduce the cardiovascular disease mortality rate in Pitt County by developing and implementing a hypertension self-management education program. Well, the Pitt County Wellness Team developed and implemented a hypertension self-management program that started in actually 2012, but as a employee wellness team, we implement that every year for our county employees. This program was designed to teach people with hypertension how to take their blood pressure correctly, as well as how to manage their disease with medication, diet, activity, and stress reduction tools. Also, the key to the program is to know your numbers and communicate those numbers with your provider. Our last class was in October of 2014, and at the end of that program, 1/3 of our participants met their blood pressure goal set by their healthcare provider. Another part of the Pitt County Wellness Team's job is to offer annual biometric screening for all county employees. And in December of 2013, the American College of Cardiology and American Heart Association released new guidelines for the treatment of blood cholesterol to reduce atherosclerotic cardiovascular risk in adults. So under the supervision of Dr. Marr, the wellness team adapted and updated our policies for cholesterol guidelines for health screenings. And part of those changes were adapting the cardiovascular disease risk calculator. And this calculator can predict a 10-year and or lifetime risk for experiencing a cardiovascular event. So out of the 764 employees that we screened, 70 of those required a referral to a primary care doctor based on the new cholesterol guideline recommendations. So it was just suggesting not that they need to be on a cholesterol lowering medication, but they could possibly benefit. And so our goal was for them just to have a conversation with their provider about what their thoughts were. And on a final note, within the Pitt County government, our wellness team adapted a new thing this year in our health screenings. We implemented the process of goal setting. We sat down with each employee and based on their health screening results, went over them with them, and they got to choose a goal or goals, and we really wanted them to focus on that throughout the whole year. So part of that requirement, if you chose a goal or decided to be in the health screening, is that you had to participate in 2 wellness programs related to the goals that you chose throughout the remainder of the year. So that was a new initiative. And then the outreach things that occurred in the community in the 2014 year was that, or Vidant reported, was that 3,270 people were served through health education and screening programs at numerous community venues. Stroke risk identification programs within Pitt County Schools staff wellness program. There was a men's community health fair and multimedia messages through WOOW radio broadcastings and recordings of monthly health topics on the Vidant Medical Center on hold message line. And then last, an outreach event within the community was that the Pitt Partners for Health, the subcommittee for chronic disease, worked with the Pitt County Public Information Office on a chronic disease awareness video. I don't know if you guys have seen that on Channel 13, and then it's available on YouTube as well, but it took individuals from Pitt County that have chronic disease or maybe have family members or had lost a loved one to a chronic disease and just kind of gave their story. And you know, in Eastern North Carolina, we like to tell a story. And so it was a great way for people to, you know, to connect and feel like I'm not alone in that. And so we just were hoping that people would get motivated by that and be like, they did it, I can do it. And so we were excited to finally finish that product up. And so if anybody is ever interested, we do have the DVD available at the health department. But you can go on YouTube anytime and get those links.
Yeah, before you step down, Brittany, does anybody have any questions for her? Okay, thank you.
Thank you.
Good evening. Just a little closer. My name is Joan Mansfield. I'm the Diabetes Program Coordinator with the Pitt County Health Department, and I'm presenting on our goal of diabetes. In 2013, diabetes was the 5th leading cause of death in Pitt County, which was an increase from just the year before when it was the 7th leading cause of death. So Pitt County's diabetes management goal was to increase by 10%, or about 600 individuals, the number of adults in Pitt County with diabetes who have attended an education course or class on how to manage the disease. And the reason for this is in the Standards of Medical Care for Diabetes, which is a guidance document for medical providers who treat individuals with diabetes, it states that individuals should be referred to a diabetes self-management education program when they're diagnosed with the disease and as needed thereafter. Research has shown that individuals who complete a diabetes self-management education program have improved outcomes, they have lower costs, they're more likely to take their medications as prescribed. They also have better control of not only their blood glucose, but also blood pressure and cholesterol. So the Pitt County Health Department offers a diabetes self-management education program, or a DSME program, and this is open to anyone in the community with diabetes or pre-diabetes, and they just require a referral from their healthcare provider. Our program is recognized by the American Diabetes Association, and there are multiple other DSME programs or diabetes education programs throughout Pitt County. ECU Family Medicine, ECU Endocrinology, they both have ADA recognized programs. And there are a variety of other forms of diabetes education programs, which will be mentioned a little bit later in the presentation. So our focus at the health department with our DSME program is on behavior change. We teach what are called the 7 self-care behaviors, focusing on healthy eating, being active, taking medications, monitoring blood sugar, healthy coping, and problem solving. In 2014, we held the 13th annual Winning with Diabetes Conference. This is a day-long conference, which is a huge collaboration between Brody School of Medicine, the Vidant Medical Center, Pitt County Health Department. We also had students from Pitt Community College nursing program, also ECU dietetic students and exercise physiology students volunteered. This year's event or theme was Diabetes Gets Moving, so we highlighted the benefits of physical activity and in being able to manage diabetes. Again, it's a day-long conference, so we have speakers in the morning. We bring in vendors. A lot of pharmaceutical companies are there to share information about the latest glucose meters and medications. And then we also offer free screenings. So we had vision, kidney, and foot screenings also.
Jonah, just note that VMCF there is the Vidant Medical Center Foundation. You'll see a lot, I think in the slides tonight of reference to,
Yes, the DSME program at Pitt County Health Department has been funded since its inception by the Vidant Medical Center Foundation.
so many of the things that are done here in Pitt County really are because of the funding that's provided through the Medical Center Foundation. So very appreciative of their
Absolutely.
assistance with us.
And then this shows just a few pictures of the other events that have taken place throughout Pitt County in 2014. In addition to the classes that are offered, we also engage in a lot of outreach events in order to promote awareness about diabetes risk prevention and management. A lot of them are collaborations. We partnered with Novo Nordisk pharmaceutical company to bring in Dominique Wilkins in November. He's the NBA Hall of Famer, you may or may not know. But he has a family history of type 2 diabetes, and he also lives with type 2 diabetes himself. And so we brought him in to speak and just raise awareness, but also motivate individuals to better manage their diabetes and recognize that you can live a healthy life with diabetes. And so, again, these are just a few of the examples of the other events that took place throughout 2014. Thank you.
You might have any questions for Joan?
Joan, how many people are you currently serving in the DSME?
So in 2014, I can't speak about the numbers with the other programs, but at the health department for the DSME program there, we received 69 new referrals, and we actually saw 13 of those patients. So much lower turnout rate, of course, than what we would hope for. We need to keep in mind that many of the patients who are referred to us are typically those patients who are not either having difficulty managing their diabetes, and they have other diseases that they're managing, as well as perhaps other priorities, trying to put food on the table, pay their light bill, transportation issues. So we have some additional funding coming up in 2015, which we hope will give us the opportunity to implement some additional programs which will work not only with diabetes management, but also more with prevention of diabetes.
Thank you.
Thank you.
Very good, thank you.
Good afternoon, everyone. My name is Robin High, and I'm the Nutrition Program Director with Pitt County Health Department. And tonight I'll be talking a little bit more with you about nutrition and physical activity. The first thing that I'd like to start with is that we do establish goals. We may need to reestablish some of those goals, but one of the goals that we have is to increase the percentage of adults in Pitt County who consume 5 or more fruits and vegetables per day, and increase the percentage of adults getting the recommended amount of physical activity. And the second goal was similar: increase the percentage of adults getting the recommended amount of physical activity to 50%. Joan mentioned earlier, and Dr. Morrow as well, that many of our programs are funded by Vidant Medical Foundation, and one of those other programs is the Farmers Market Nutrition Education Program. It provides opportunities for the community, Pitt County residents, to learn about locally grown foods and in-season produce. Jackie Sugg, one of our dietitians at the health department, oversees that program. It runs through May through August, so it's already in session. And last year, we had almost 2,400 samples that were provided. And every year since the program has been going, the numbers have increased. Also with this program, not only do people get to see how the produce is used and how to prepare it, but they also get the recipes provided to them as well. Another program that is near and dear to my heart that I've talked to you all about before is the WIC program, the Women, Infants, and Children's Program. We do food sample tastings quarterly, and these are in tandem with our WIC mini lessons. So food sample tastings are coupled with those mini lessons, and they're held for both our clients, they're held for the participants at the health department that are there that day, and they're also available for our staff. And we use that as a teaching mechanism both for everybody, because not only does it help the participants learn how to use some of those healthy foods, but it gives them opportunity to try it. So they're learning how to cook it, prepare it, and they may be able to try foods that they have not tried before. We also had another initiative last year that's called What's on My Plate. And I think I've talked to you all about this before, but the program was very successful. We actually have a display at our health department if you've been there recently. Families prepared meals or snacks from selected healthy recipes. They took photos of those recipes with their smartphones, and so they brought it back to the health department. We downloaded it, and we put the pictures on a display board. And of course, you know, they gave consents and all those types of things. And as what the purpose was of this is for families to try these recipes together. And so it was really more of a peer-to-peer initiative, and it worked well. They used comments, and very effective. So we are still continuing part of that program. And again, people like to see pictures and they like to see comments. Another program that was launched July 28, 2014, remember that date by heart, is Crossroads. Crossroads was launched around North Carolina in increments, but again, for Pitt County, it was July 28, 2014. It's a new federal WIC processing system and an electronic medical record that helps streamline services for our clients. Family information is documented and it's linked together, which helps give a more complete picture of the household. And while we're still learning things about Crossroads and its functionality, we know at least, or it appears at least, that it helps improve wait time, which also helps improve customer service. Another program that we participate in, all of our partners, is the Growing Up Fit program. Another partner in our community is WITN. Each month, there's a segment, it's taped, and it's aired on the WITN TV Sunrise Edition to promote healthy, consistent nutrition education messages targeting children and families. So this particular slide shows Susan Marquez. She was an ECU dietetic intern. We worked with many of those. We worked with lots of ECU students to help out with this process. Some of the topics include eating healthy on a budget, which was done in April. Pitt County Parks and Recreation and healthy snacks. That was actually done in May and today. Jackie Sugg, thanks to her for helping out with that in my absence. And then focus topics such as prevention of diabetes and heart disease, and especially with the focus on early intervention. That's really the point. So, many people sometimes think that diabetes and cardiovascular disease is an adult disease, but really we're seeing this more and more in children. So very important to get that early intervention message out there. And in fact, Joan, who just spoke, she'll actually be on the program with me in June. And then August, we have the World Breastfeeding Celebration. And again, many things that we do are in tandem with some of the programs that we're talking about today. And as you can see and hear from just hearing this part, we have so many partners and collaborations, and if we didn't, it couldn't work. So I wanted to really thank those partners and those collaborations. Another initiative that we did this year, 2014, was every National Nutrition Month, our Pitt Partners for Health Subcommittee, Nutrition and Physical Activity Partners, selects an activity that they'd like to do for the month of National Nutrition Month. So in 2014, we did puppet shows, and this was a partnership which was formed with Shepherd Memorial Library as well as the ECU School of Communication Health Puppetry Initiative to provide free puppet shows targeting nutrition and physical activity. Approximately 75 people attended that event honoring National Nutrition Month. There was also storytelling and some other interactive activities that we did. And we also provided healthy trail mixes and also the recipes with those. So again, another example of that teamwork and collaboration. Another initiative that we wanted to mention that happened in 2014, but also is now in 2015, is Mission Nutrition. So what this was a focus on Cooking Matters at the Store tours, which was held at 11, was held for 11 people, and they were actually food assistance program leaders. We did this in an effort that once we taught these program leaders about budgeting, healthy eating, unit pricing, things like that, they would take it back to their participants and their recipients. And so, what was involved with that program was that they went through the tour, and at the end they had a $10 challenge where they actually had to use all of the food groups, and they were actually provided with $10 to do so. And again, thanks to Vidant Medical Center Foundation and Vidant Community Programs for assistance with that. And so next year we'll have more about our March 2015 National Nutrition Month activities, which was the grocery store tours targeting those recipients and those participants. Any questions?
Does anybody have any questions for Robin? Okay, thank you very much, Robin.
And I'll turn it over to Alice King.
Thank you, Robin. Good afternoon. It's a pleasure to be here with you to talk a little bit about community schools and recreation and Pitt County schools and our district park. New for 2014 in our district park is our track trail. And again, you've heard a lot about partners already, and you're going to continue to hear this in the presentation. And many of you know I've been around for a while. And for me, the partnerships in Pitt County really set us apart from other counties across the state. I've never heard of or been involved with an area where people really do bring the resources to the table for the citizens of our county. And I think that makes Pitt County a very special, special place. You'll see our track trail in the park was made possible by Community Schools and Recreation, our health department, Pitt Partners for Health, and again, our Vidant Medical Center Foundation, working in cooperation with a Blue Cross Blue Shield grant and the Center for Public Health Quality. Track trail really does encourage children to get out and be more physically active, but it also encourages children to learn about nature. Too many times children do not spend much time outside. We have a series of 4 brochures with guided adventures through the trail in the park, and when children come back and log in those adventures, they get to earn prizes like stickers and badges and backpacks. Again, that just encourages them to come out more. We're proud to be a part of that national network. Our track trail is on their website, so it brings hopefully people to our county and as well as to our state. Community Schools and Recreation over a lot of years, as some of you know, have provided youth sports in our community. Under the leadership of Rita Roy and our staff, they continue to do a great job with youth sports, ages 2 to 18. And I must say that that group of 13 to 18 is a little unique for youth sports programs, because in a lot of Parks and Recreation departments, they have cut their age back to age 12. Gets a little more challenging for that 13 to 18-year-old age group, but our belief is that is a group that really does need that experience, that physical activity, that opportunity to still be a part of a team, and probably just as importantly, an opportunity to have some very positive, strong role models in their lives. We do provide youth soccer, basketball, volleyball, and flag football, and since the start, we have really placed an emphasis on positive physical activity, learning skills, hopefully to enjoy those sports for a lifetime, teamwork, sportsmanship, having fun, and for many families, that is a very positive family time when the whole family does do something together. And our district park has really provided a wonderful new opportunity around our youth sports, because there's so many other amenities, the playgrounds, the trails, for everybody in the family has something to do. Picnic shelters for shade, farmers market across the street. It really has added a lot to the program. On the other end of the scale of the lifespan, we continue to be the lead agency for the Greenville-Pitt County Senior Games program. We do have seniors involved in year-round programming, and believe it or not, this summer we're taking a 50-plus men's team, a 70-plus women's basketball 3-on-3 team, an 80-plus men's 3-on-3 basketball team, and several individual competitors to national games. We are real proud of our seniors. Our seniors are really involved throughout the year, and again, that's what keeps them active and involved, staying in their own homes, volunteering all over this county, doing the things they love, and hopefully not visiting our hospital very often. We're very involved in local games and also state games as well. You know, in a large rural county, the best way to reach the most children is through the school system. And again, our community partners have rallied around that, not for 1 year or 5 years, but really in earnest over the last 20 years. We've rallied together to provide programs such as the Presidential Active Lifestyle Award program that involves kids in physical activity, and again, gives them incentives for being involved. Our after-school programs all include real emphasis on physical activity and a healthy snack. So again, we're providing interventions and incentives in our schools to reach the largest number of students possible. We want to help those students at a very young age develop healthy lifestyle behaviors that hopefully they'll continue. across a lifetime. Again, through our health department and the CPPW grant, we were able to finally, about 3 years ago, reach one of our goals and dreams, and that was to develop a staff wellness program for Pitt County schools. Through Community Schools and Recreation, we continue some of the components of that staff wellness program, two of which are mentioned here, a co-ed softball league and also exercise classes. And it's been real interesting to watch the dynamics of, again, just a positive physical activity, a recreation activity, when principals and teachers and other members of our school families get to join together on a team and come out and play softball. It's a lot different than the center of the school, and we believe a lot of positive things happen through those experiences. Again, we've placed emphasis on not only physical activity, but healthy eating, and our Vidant Medical Foundation has helped us to do that with helping us to have a registered dietitian in our school system. Teachers that are involved in a program called Taste Explorers, so that students have a chance to taste different fruits and vegetables, and perhaps they get to taste at home, and also nutrition nuggets. This has been done and mostly coordinated through our child nutrition program. Again, with our community partners, our overarching message is Eat Smart, Move More, where we live, learn, work, pray, and play. And we're just happy to be one of the community partners that's making good things happen in Pitt County. And I'll turn it back over to Amy.
Before you leave, I have a question or two, please.
Oh, okay. I'm sorry.
With the track trail,
Yes, sir.
how is the maintenance of that handled?
Well, the trail itself is asphalt. So we, our facility services through Pitt County help us some. Staff do a lot. And most recently, we've had a couple of volunteer groups that have called us and said, hey, can we come out and do a project in the park, help you, however you see fit. And actually a group from Target a couple of weeks ago helped us trim back some little limbs that were beginning to hang over the trail and that kind of thing.
My other question is kind of self-influenced by the status of my life age. I was interested in the senior games. The percentage of the population in Pitt County over 50 is how much? Do you know?
I am not certain. I don't know if anybody else here. I should know that percentage, Dr. Morrow, but I don't.
Okay.
I know there's well over 16,000 that are 65 and over, but that we need to go younger
Right.
for your question.
Does your department, or do you know of a department that teaches Tai Chi in Pitt County
We
to adults?
do have Tai Chi in our Community Schools and Recreation Center, but there are also, I know, Vidant Medical Wellness Center, I believe, has Tai Chi. No?
No, they
Okay.
did at one time, but they have stopped that, and I didn't know if, I know that a lot of places have more participants for yoga, but those of us like myself that have vertigo, yoga is not anything I can do myself.
We do offer Tai Chi and yoga in our center. However, at the current time, they are offered during the day. But again, we will register your question as a need, and as those requests come in, then we look at expanding those opportunities.
Thank you very much.
Other questions?
Any other questions? Dr. Morrow's got a chart over here.
I can't tell you over 50, but I can tell you 22% are between 45 and 64, and then 11% 65 and greater, so.
Yeah. A significant percentage, and as we all know, that percentage is growing.
Yes,
Very good, thank you.
growing rapidly.
I'm going to share with you 3 additional priority areas: tobacco control, infant mortality, and sexually transmitted diseases. First, tobacco prevention program. Pitt County Health Department, we were fortunate enough just recently, within the last 6 months, to receive a CDC grant from the state. And the focus of this grant is to help prevent smoking and other tobacco use, eliminate exposure to secondhand smoke, help tobacco users quit, and eliminate tobacco-related health disparities. And this grant started out covering 4 counties, and as of April, it's expanded to 10 counties in the east. We are fortunate enough to have a tobacco prevention and control coordinator. Manika Majette just joined us. She came from Craven County. And so in another meeting, we'll be glad to share with you activities of this grant, since we're just getting started implementing those. The next item on here, tobacco-free parks rule. I know you're all familiar with that. This board did draft a rule for consideration for tobacco-free parks, and the whole reasoning behind that was to protect children from secondhand smoke and poisoning in our parks. The rule, of course, was approved by this board in March of 2015, just recently, and it was presented to the Board of County Commissioners in April, but it did not receive approval. So very disappointed in that, but we still have a lot of work to do to maybe move forward. An additional goal, infant mortality and unintended pregnancies. The goal for this particular priority area is to reduce Pitt County's infant mortality rate, which is the death within the first year of life, to or below the state's rate, with special emphasis on reducing the infant mortality rate among low-income African-American women of childbearing age. That is where the majority of our infant deaths do occur in Pitt County and in North Carolina. Our most recent statistics, Pitt County's total infant mortality rate did decline in 2013, but we continue to be higher than the state's rate. We always benchmark ourselves as how well we're doing compared to the state. So like I said, it did decline, but we were higher than the state's rate. Pitt County in 2013, our infant death rate was 9.9 per 1,000 live births, compared to the state, which was 7.0 per 1,000 live births. Although there is some good news. Pitt County's non-Hispanic African-American infant death rate in 2013 declined from 19.2 per 1,000 live births, which it was in 2012, to 10.2 per 1,000 live births. Not sure if all the work that's been done over the years that have been targeting our African-American population has paid off, but we're hoping that we're going to continue to see this decline. We're hoping it'll be a continued decline for the following year.
Amy, just clarify, we're talking about, the rest of this report is about 2014, but I think people need to understand we're about a year behind on that
Yes.
data. Would you explain that?
Yeah, we are with all data. Usually it comes out periodically, but in the fall. And it takes a while, especially with infant mortality data. It takes a while to collect birth and death certificates across the state, maybe from other states. You know, our counties border other states. So it takes a while to get that information and collect it and get it in a finalized report. But that's not just with infant mortality, that's with all of our data. It takes a while to collect it. So all of this is our 2014 report, but some of this data might even be 2013 or previous, but it's the latest data we have to share.
So we won't have the 2014 infant mortality rate probably until August or September maybe this year.
Probably, might even be as late as October. It's coming out a little later. Yeah.
Thank you.
Yeah. This graph shows you the comparison among races from 2010 to 2013. And as you can see, our African-American rate, how it's always and continues to be higher than our white rate. However, you can see that dip in 2013. So the white rate did go up a bit, but it continued, even though with the white rate rising, the African-American rate continued to be lower for that particular year. I think that was 21 deaths, and out of that 21 deaths was one set of twins. Leading causes of infant mortality, this is in North Carolina and Pitt County. Birth defects, prematurity, which is a baby born before 37 weeks gestation, 3 weeks before the due date, or sudden unexplained infant deaths, which falls under that is SIDS, sudden infant death syndrome, accidental suffocation and strangulation in bed, which we're starting to see more of that, and then unknown causes. Activities that we have pulled together to address the problem. Our Pitt Infant Mortality Prevention Advisory Council, better known as PIMPAC. Again, this is numerous community partners working collaboratively to save babies. is still going strong for over 25 years. And this particular group manages various activities related to infant mortality prevention. The Advisory Council, PIMPAC, oversees various grants, and these are 3 of them. There's a Healthy Beginnings grant that supports a Resource Mothers program. It's a case management program where women are case managers or resource moms are linked with high-risk African-American women that have the potential to have a poor birth outcome. And we've had this grant every 3 years since 1995, and the outcomes are very good. We're showing fewer death rates. It's very rare for a baby or mom that's enrolled in this program to have an infant death. Birth weights among these babies are higher. So we have a long track record of being able to measure the women that are enrolled in the program. There's also a Healthy Start grant that partners with the Healthy Beginnings grant, where we can find individuals who are non-compliant to care and make sure they are linked with resources. And then another home visitation program, Nurse Family Partnership. This works with first-time moms and very young moms. And all 3 programs work together to make sure individuals are linked with the necessary resources. They're, again, designed to help improve birth outcomes. We also have our Triple P Positive Parenting Program. And I don't know if you've seen all the billboards that are around town, but these billboards are supported by 2 grants, a NACHO grant and a grant from the state. And through this grant, we're actually training individuals to be parenting providers or parenting Triple P Positive Parenting trainers, that they can actually provide this parenting resource throughout the county. So these billboards are everywhere, and we want parents to get the message. This is an evidence-based program that is over 30 years old, is out of Australia. It has great outcomes, and we're hoping that it'll be around for a while, but right now it is grant supported. I think there have been over 100 providers that have been trained in various organizations throughout the county. Additional initiatives, of course, Robin mentioned breastfeeding through the WIC program. We do have our Better Beginnings in-home breastfeeding program, where there's in-home support for individuals that are breastfeeding. Our PIMPAC World Breastfeeding Celebration is held every August. There'll be another one coming up this August, where we try to provide resources to women who are breastfeeding, or encourage women who are not breastfeeding to try it. And Pitt Medical Center Women's Services also has celebration and a huge breastfeeding support program, and we often collaborate to bring the 2 programs together. Our annual Making Pitt's Babies Fit Maternity Fair, we just had our 23rd annual back in this last month in April, but these are pictures from the 22nd annual. This event was implemented, 20-some years ago, 23 years ago, as a way to link individuals with resources. They're, again, designed to improve birth outcomes. It's become a very popular event. We have anywhere from 500 to 1,000 individuals that attend each year, and we have between 80 to 90 vendors that participate. And this is just showing you one of the displays, and there's also, in the corner, there is a safe sleep exhibit where there's a crib and all that's set up. This was a giveaway. Several sponsors in the county, Lowe's, Kmart, Babies R Us, they donated these items. We were able to display a safe sleep environment, and then a lucky, needy family received this through a drawing at the end of the day. And in talking about safe sleep, that leads me into another group that was formed in 2014. This group was formed by Pitt County Sheriff's Office, the Medical Examiner's Office, Pitt Medical Center, Injury Prevention Program, and the Health Department, due to the number of death by overlay, babies that are in bed with their parents asleep, and maybe an arm or a parent rolls over on the baby. They were starting to see more and more cases of that. So this group has been formed to provide safe sleep education throughout the community. We've also partnered with Pitt Medical Center and with the Office of Health Access at Brody School of Medicine to offer Cribs for Kids program. And this is where parents who are in need are able to receive a pack and play, and safe sleep education is a $10 fee for them to get the pack and play. When they get that, they get instructions on what a safe sleep environment should be in their home. We also continue to have a child care health consultant program, and this is funded by Martin Pitt Partnership for Children, which is our local Smart Start agency. And this continues to help child care centers and home prevent the spread of disease and injuries within the center. We've had that grant for several years as well. Through our infant mortality initiatives, we also have a youth development program. It's teen pregnancy prevention. Our health department holds regular groups in selected middle and high schools, and these groups focus very little on teen pregnancy. It's more on self-esteem, goal setting, career building, and peer education activities, which in hopes will prevent or delay teen pregnancy. And in 2013, Pitt County's teen pregnancy ranking among 15 to 19-year-olds was 64, meaning we were the 19th lowest out of 82 ranked counties. Another priority area that was selected in 2011 was sexually transmitted diseases, and our goal was to decrease chlamydia rates by 10%. That goal was chosen because of our high rate of chlamydia at that time among all other sexually transmitted diseases. And I am happy to report that Pitt County's number of newly reported chlamydia infections decreased by 9.5% between 2012 and 2014. Not quite 10, but we're almost there. And this shows you a chart of how the numbers. You can see in 2012, it was well over 1,600 cases of chlamydia infections that were reported, and you can see the drop to 2014. So we hope that continues. This next slide gives you an update about the health department's communicable disease clinic. In 2014, the number of screenings that were performed, you can see there were over 6,000 for gonorrhea that were performed, over 4,000 for chlamydia, over 4,000 for syphilis, and over 4,000 for HIV. We did add a second walk-in clinic. It was on Mondays. We'd implemented one the year before on Wednesdays that people could come in without an appointment. And that was so successful, we decided to add a second walk-in. So now there's walk-in Mondays and walk-in Wednesdays. We did have some state funding to implement a community event called Let's Get Real Sexual Health, which is a community conversation among women of all ages. The purpose of that event was to inform women from the religious community about healthy lifestyle habits that can help decrease the risk for STDs and chronic diseases, such as heart disease and diabetes, and the information, the messages that they could spread out to the community themselves just by them coming and hearing the information and the impact that they have on their community. And just to also share that we do work with Picasso, or Pitt County AIDS Service Organization, and Vidant Medical Center Foundation, as Dr. Morrow mentioned earlier, funds a lot of these initiatives. They did fund Picasso in 2014 to implement educational sessions and to do HIV testing and education. So you can see that they made a large impact. Any of the testing that they do, and anyone that is has a positive test, they are referred to the Brody School of Medicine Infectious Disease Clinic for further treatment and follow-up. And now I'll turn it over to Mark, foodborne illness. Or any questions, I'm sorry, before we move forward.
Again, could you remind us, how many folks came to the maternity fair, you think, just ballpark figure?
It varies from year to year. This year it was a little over 500. We were competing with a really bad weather day. We have had as many as 1,200 to come. It just depends on the year and other events that are going on, what we're competing with for the weekend.
Well, I was impressed with the number of vendors that were there. It was all over the floor, so.
Yeah, and we appreciate you coming. Yeah, it was a great day, and I think a lot of their attendees were happy that they had more time to go to each vendor, that it wasn't quite as crowded this year, so they had more time to have some one-on-one from each of the vendors.
Afternoon. I'm Mark Phelps, Environmental Health Director. My priority area was foodborne illness. Our goal was to fully implement the new FDA food codes with all food establishments in order to ensure that the average number of critical violations are at or below the state average. Our activities towards achieving that goal included environmental health completing 95% of restaurant inspections for 2014. Environmental health also enrolled in the FDA Voluntary Food Regulatory Program standards. These standards had two goals. The first goal was to provide retail food program managers a tool to evaluate their own programs. And second was for regulatory agencies, ourselves, to have an opportunity to improve and build upon our existing programs. As part of the program standards, Environmental Health surveyed over 220 randomly selected food establishments to identify risk factors. Based upon these survey results, we were able to determine 3 key items of concern. The first was proper cold holding temperatures based on the food code recommendation of 41 degrees Fahrenheit. FDA has reduced the recommended temperature from 45 down to 41 degrees Fahrenheit to try and reduce the risk of listeria. 62% of the facilities that we surveyed were not holding at 41 degrees Fahrenheit. Next was date marking of potentially hazardous ready-to-eat food items. 62% of the facilities were not following the requirements for date marking of these items. And third, having and/or utilizing an employee health policy. 45% of the facilities that we surveyed were not using an employee health policy. So we have this information in hand, and we're gonna focus on that with our future efforts from this point forward. Environmental health was also awarded 3 FDA grants in 2014. We were one of only 2 counties in the nation who received all 3 of these grants. And we used these funds to send the food and lodging staff to Georgia for some additional training on the FDA Voluntary National Retail Food Regulatory Program. We were also able to purchase new testing equipment for use in our food inspections, and we were able to provide community outreach efforts through the production of 4 safety training placards, which we provided to our food establishments. Any questions?
Yes, can the public go on a website or come to the health department to find out what establishments are meeting or not meeting these criteria?
Yes, it's public record, and anyone can come to the health department, or to environmental health, and we can provide them with that information. It's also available through, I believe it's WRAL's website, and we're trying to work right now towards possibly getting that information so it can be linked to directly through the county website.
Thank you.
Yes.
Any other questions? Yeah, thank you.
Good evening. I'm Chloe Kongs. I'm from Vidant Cancer Care. I'm the outreach coordinator there. I just started this role last week, so it is truly a pleasure to be here, and I'm happy to meet everyone. So as you can see from this first slide, we have made some improvements in our mortality rates, as cancer is now the 2nd leading cause of death in Pitt County, whereas in 2012 it was number 1. You can also see that we fall below the state mortality rates in all cancer areas except for breast and prostate. But overall, for all of our cancers, we are still below the state level. We've been very busy at Vidant Medical Center, so I'm going to discuss to you some of the things that we've been doing the last year and have started this year. Last year, we have provided cancer screenings for breast, colorectal, cervix, skin, and lung in an effort to promote early detection. We had 39 awareness programs that reached over 1,000 people, and we had several media events that reached an estimated 3,500. We have 5 screenings with 163 people attending. We're hoping to plan on more screenings. I have an additional 2 for the summer, so I'm hoping to double that, if not more, next year. We also have started a low-dose CT scan program. It was implemented in November of 2014 at all Vidant hospitals to help detect lung cancer in early stage. We've also implemented our cancer care navigation program, and this was started in December of 2013. We're very excited about this because now every cancer patient has access to a navigator. A navigator provides care along the entire healthcare continuum for patients and families, and they help to remove barriers that are common to the healthcare system. They also help facilitate care close to home and assist with overall cancer coping. Last year, our navigators served 950 new patients with 8,500 total patient visits. We had several navigation outcomes due to our implementation of these navigators. We have better focus on our 5 top disease sites, and those are lung, breast, prostate, colorectal, and head and neck cancers. We've also had a decrease in inappropriate ED admissions as our navigators are really focusing on ensuring that our patients have access to their medications before they leave the clinic or discharged from the hospital. In addition, more patients are receiving quality care closer to home, which is a huge patient satisfier. We've also fostered a multidisciplinary team to approach to our cancer care, and we're ensuring that we're utilizing doctors, nurses, social workers, pharmacists, and dietitians, and we're focusing on all aspects of our care. That includes psychosocial and spiritual care. For 2015, I'm very excited about this because I'll be working very closely with this initiative. In March, we launched our 80% by 2018, and our goal is to have 80% of adults aged 50 or older screened for colorectal cancer by 2018. We're teaming with several local and regional groups, as well as the American Cancer Society and the North Carolina Advisory Committee on Cancer and Coordination Control. In March, as I stated, we launched this, and we held an organizational-wide kickoff, Wear Blue for Colorectal Cancer, and we made some little buttons. I have the button here with me. And when I was in my previous role, it's kind of neat because I didn't know this. I actually designed this button, so everything's coming full circle for me. Before your years are stolen, know your colon. Get screened for colorectal cancer. And I always say that my supervisor at the time gave me one night to create this. So I said if I would have known it was going house-wide, I would have, I mean, I love it, but I didn't really realize that the whole facility would be wearing it. So I hope in my new role every month as I follow the American Cancer Society's calendar, I hope to just create simple things like that for health cancer promotion and awareness. If you've been by our facility lately, you may notice that big hole in the ground. In March, we had our groundbreaking event for the Cancer Center, and we're very excited about it. The Cancer Center has an estimated completion date of 2018. That seems far away, but we're marking one day down every day because we can't wait. It's going to have state-of-the-art facilities. It will have coordinated care among multidisciplinary groups, and it's going to allow access to more providers, as one of our goals is that we hope that we attract new physician recruits with this facility. And it will truly be a one-stop for cancer care for our patients. And that's a simulated picture that you can see there of what it'll look like. On this last slide, it just details some of the things that will be included in our new facility. And some of my favorites are an outdoor healing garden that when patients are receiving their chemotherapy, they'll be able to view the healing gardens. It'll be a really relaxed therapeutic environment. And a resource room for complementary therapies. I also have a brochure with me, and I'll leave it with Kristen for you all, and it just highlights some of the areas at this facility. And I just wanted to emphasize that this is only some of our initiatives that we have implemented to decrease the rate of mortality of cancer. And we invite you to view our microsite. We just got our microsite up and running. I wasn't able to get it on the slides, so I'll repeat it. It's cancercare.vidanthealth.com. And I'll repeat it one more time since it's not on the slide. That's cancercare.vidanthealth.com. And I also have copies of our 2014 annual report. This really lists nearly all the initiatives that we have done, so I'll leave copies of that as well with Kristen. Can I answer any questions?
Very good, and thank you, and welcome to Pitt County.
Thank you. I'm very happy to be here. I told Phyllis, our administrator, she said, "Are you sure you want to go?" I said, "Absolutely. I'm excited to meet everyone, and I'm excited to serve our community."
Thank you.
Thank you.
So I also serve as the breast and cervical cancer control outreach nurse. And so you know that's a program that the health department gets funding from the state and the federal government. And with the North Carolina Breast and Cervical Control Program, that program really focuses on women over the age of 50 for more of a screening mammogram and services. So we are very privileged to receive funding from Vidant Medical Foundation for funding for those women between 40 and 49. So with a partnership with James D. Bernstein and Eastern Radiology, the Breast Imaging Center, we are able to offer well, not exactly monthly, but we've had able to do 8 breast cancer screening clinics at Eastern Radiology in 2014. And some of those were Hispanic and some of them were English-speaking clinics. So we are trying to capture everyone and so they can get in and get a screening mammogram. And at those clinics, they come in and they get a clinical breast exam and they get a mammogram. And then at the end of their visit, they get some breast health education and a little baggie to go home with so that they can read up and kind of be aware of some signs and symptoms of breast cancer. So that was conducted, and we served over 123 women in 2014 as well. And then also part of that job is I go to different outreach events. I know I've been to the Latino Festival in the past, but this picture here specifically was at the Pullen Fire Engine Pool at the Greenville Police Department this past fall, where they pull the fire engine as far as they can, but it's got also different community resources that are available so people can learn about different cancerous resources in the community. So, any questions? Thank you.
Thank you.
Good evening. My name is Stephanie Keene. I'm with the East Carolina Injury Prevention Program, also called ESIP. My last name is Keene, but I'm no relation to Alice. I'm also, unfortunately, I'm also new to y'all, but I have been in Greenville for a while. ESIP, as it's called, is in its 20th year of operation, and it's a collaborative effort between Vidant Medical Center and the Brody School of Medicine. I want to talk about some of the ongoing community initiatives that are going on now, and I also want to highlight 3 new programs that have happened within the last year. So for the ongoing, you have the occupant protection, which includes child passenger safety. And this is a program where they check safety seats for children. They partner with Greenville Fire and Rescue, and they have 7 permanent fitting stations to provide seat checks for the entire community. Anybody can come. Annually, they will check 900 seats. That's pretty good. They also have teen driver safety and older adult driver safety. There's falls prevention, and at the last Falls Fair, they don't call it Falls Fair anymore, but the last Falls Fair, they had over 270 participants who came, and they will come and be screened for things for risk of falling at home. They'll have PTs there, they'll have doctors and nurses, so it's a really great event for the community. Also pedestrian safety and sports safety. So those are some of the ongoing ones. Let's see. One of the new ones is a teen safe driving video, and then I'm going to go into sports safety, and then I'm going to go into a program called Active Routes to School. The teen safe driving video is in partnership with local law enforcement, first responders, health officials, and others. And the production and filming of this video was done with all these people coming together. The film is called Take the Option, Responsible Choices in Driving, and it's currently shown on local TV stations, driver's ed classes, and other driving classes. If you will go to YouTube, you'll see that picture where it says Take the Option. Just search for Take the Option. And it's a great video, and I would encourage you to watch it. It lays out 3 different scenarios or 3 different paths that teenagers can take when it comes to drinking and driving. And it also gives the consequences for each of those paths. So it's a really good tool to initiate a better conversation when it comes to responsible driving and responsible drinking as well. All right, the other one is sports safety education. This is in partnership with Pitt County Schools and the ECU Sports Medicine. The 3 pictures that you see there are 3 of the 4 stations that they will have in their clinics, and it's targeted to 6th graders and the coaches. The clinics will focus on concussion prevention, hydration, nutrition, physical strengthening, and injury care. And in each of these stations, they will learn some information, but it's also very interactive, so they do really learn. They have a pre-test before they come to the clinic. They'll go to the clinic, and then after the clinic, they'll have a post-test. And evaluation results indicate a 36% increase in knowledge about sports safety. Over 5,000 people have been impacted by sports safety outreach. And the last one is active routes to school. I'm actually the coordinator for this region, which includes 9 different counties. I have to use my fingers. So you have Beaufort, Craven, Carteret, Pamlico, Pitt, Greene, Lenoir, and Wayne, and another one that I will give. There is a video that I want to show that gives a really good introduction on it.
People across North Carolina want safe and appealing options for walking and bicycling in their communities, including the trip to school. In response to that need, the North Carolina Department of Transportation and the North Carolina Division of Public Health have established a joint partnership project called Active Routes to School. 10 regional Active Routes to School coordinators are working across North Carolina to increase awareness about the benefits of active travel to school. Many children aren't getting the physical activity they need. Getting to school on foot or bicycle offers an opportunity for students and families to burn off energy. This helps with children's health and learning and also benefits the community through reduced traffic congestion and helping create a sense of neighborhood. Regional Active Routes to School coordinators work to raise awareness, support walking and bicycling programming, deliver training, change policy, and identify improvements to the physical environment that improve safety for students of all abilities. For some communities, walking or bicycling to school is just not an option. In these situations, schools can use remote drop-off programs and walking on the school campus to help children get the physical activity they need as well as practice valuable safety skills.
Of course, the first benefit is the emphasis on physical fitness for our students. The second benefit is the emphasis on physical fitness for our staff. We work hard to put that at the forefront. In addition to our academic excellence, is that we take care of our bodies and we are physically fit, and we have a sort of intentional purpose to make that happen.
Since 2006, the North Carolina Department of Transportation's Safe Routes to School program has focused on increasing safety for K-8 students traveling to school by foot or bicycle and developing facilities that everyone can use.
This is part of a bigger plan. We have a North Carolina bicycling and pedestrian plan. This is not a one-off. This is something that's part of a bigger plan to promote an active lifestyle, to promote bicycling and increase pedestrian uses.
Well, for children, we know that it takes 60 minutes a day of physical activity for them to have a health benefit from those activities. So the goal is to promote as much health as we can and actually academic achievement as well. Both of those things improve with 60 minutes a day of physical activity.
Active Routes to School is just one of the many ways that NCDOT is responding to the requests of all North Carolinians. For more information about the statewide pedestrian and bicycle master plan, visit ncdot.gov/bikeped. For more information about the Active Routes to School project, visit communityclinicalconnections.com/activeroutes.
I'll get it. Yeah, you can feel free to help. Sorry, guys.
Oops. That we do this.
Does this program maybe help the powers that be locate the schools that these children are supposed to be going to and from a little smarter?
Yes, that is definitely a part of it. The goal is to get more kids to walk and bike to school where it's safe, and where it's not, to recognize and identify what those issues are, and where it's never going to be safe, to implement programs, thank you so much, at school. That's good, that'll work. So that, yes, that's definitely part of it. It's a grant program that goes through June of next year. And the picture that you see here, in the video, there's another video that's an extended version, and it has more about a walking school bus. So Pitt County was definitely highlighted with Ridgewood School because they have a walking school bus, and it's been going on for years. It's very vibrant. They have a lot of participation from the parents. Also, these kind of things get people aware of the need for this because it increases activity for the children and decreases obesity. This picture here is a one-time awareness raising event, and this was the International Walk to School Day last October. This one was at Eastern Elementary School, and we were told to prepare for about 20 to 30, so we were hoping for 50. We prepared for 100. I was optimistic, and we had over 200 children that came, and their parents came as well. And these one-time awareness raisings are good because parents have called and told me that they didn't really think about allowing their child to walk to school because of safety issues or perceived safety issues, but it also brings the community together, and different partnerships again with local law enforcement, nurses at the hospital, and a lot of people in these rooms. Or in this room. All right, these pictures, the top two, again, are at Pitt County for last October's Walk to School Day. The bottom picture, I had to bring something in that was regional. So that is at Bangert Elementary School in New Bern or in Trent Woods. Again, it's about walk and bike to school day events to raise awareness, where it's never going to be safe for kids to walk to certain schools if they're off a highway, and especially in rural areas like we're in. You can do programs at school so that they're active. So we have a couple schools that are doing Walk Across America in their schools, where they are kind of clocking their miles that they walk at school to get them across the U.S. So it's close to 3,000 miles, and they're doing really well with it. And they get so excited because, of course, there's incentives, and they have different bands, different colors for distances. The Let's Go NC curriculum, that is a curriculum that was developed by North Carolina Department of Transportation. It's a K-5 curriculum on bike and pedestrian safety. It's a great curriculum. It has a lot of lesson plans and videos that are relevant and up to date, and it's easy to implement. We've gotten a lot of great feedback. There's a school in Carteret County now that we've ordered close to 400 helmets for their kids, for second and third graders. They're having a helmet fitting. They're learning this curriculum, and then next week we'll be doing bike rodeos with them so they can put their skills to action from what they've learned. Okay, and this one is from the National Bike to School event 2014. This was at W.H. Robinson Elementary School in Winterville, and we had close to 50 children that came out, and their parents brought them and their bicycles. And again, it shows the great partnerships because you have Winterville PD, you have Sheriff's Department, Greenville Police Department, you have the teachers, community leaders were there as well, and they had a really great time. This is a picture of a toolkit that another coordinator in the state and myself have developed that kind of has everything in it that you need to know about active routes and how it can help in your school or community group. I didn't bring one because we just got them. They're literally hot off the press. So if you are interested, just let me know and I can bring you one. Any questions?
Well, thank you very much.
Thank you.
Moved from afternoon to evening, so good evening. My name is Kayla Hall. I'm the Director of Community Benefit Grants Program of Vita Health Foundation. I know some of you are aware of the program. I think Dr. Kirkendall, Dr. Morrow, and Mr. Peralta are aware of the program. But for those of you who not heard of it before, it was established back in 1999. The funding comes from Vita Health. Vidant Medical Center gives money every year. They give $1 million to distribute in Pitt County in the form of grants to organizations that seek to improve disease prevention and management, provide more nutrition, education opportunities, and physical activity opportunities, and improve access to care. We also have funding that comes from Vidant Health to our regional hospitals, and they distribute $100,000 each in those communities. We award approximately 50 grants every year, and right around $1 million. Sometimes it's a little bit more. And the years that it's a little bit more, we have what we call return funds. If they don't spend all the funds, they return them, we put it into account. And if we need to access another year, we can do that. In the area of diabetes, one of the programs we fund is Firstborn Community Development Center. I'm sure you all have heard of them. They have 2 monthly food distributions. One is geared toward the general population and one toward diabetics. The one for diabetics has more items, that include whole grains, whole wheat breads, sugar substitutes, skim milk, those types of items. They serve 172 individuals. The program includes armchair exercise that they do when they come in. Then they have a nutrition education or healthy cooking demonstration. And they also provide delivery to homebound clients. The Brody School of Medicine, Department of Family Medicine, has a program called Bridge. It's based on, doing some one-on-one counseling and also some group counseling. This targets the more at-risk, higher complex diabetics, whereas the health department program works with those who are newly diagnosed, but ones who are more complex need a little bit more care. They work with a registered dietitian and a pharmacist. This past year, they served 231 at-risk patients. 69% improved their A1C levels, and 68% lost or maintained weight. In the area of nutrition and physical activity, A Time for Science, they take outdoor activities, have the kids, lots of fun for the kids, but also incorporate some science in there as to, how your body's burning calories, why it's important to eat healthy, and just so they're learning at the same time that they're having fun. They were able to provide services to over 3,500 youth through scholarships through our program. Triple Play program with the Boys and Girls Club serves 443 students. They participated in games that increased their levels of physical activity and knowledge about nutrition. So again, get the kids out there having fun at the same time, give them some education and nutrition and some increased physical activity. The Snack RX program was a partnership between ECU Department of Nutrition Science and the Boys and Girls Club of Pitt County. The main goal around this was to, eliminate the vending machines and provide healthier snacks. And they were able to do that economically by showing them that they could purchase some things. We started this out as a partnership. I think I called on Robin High and several other individuals in the community to come together to look at the resources that were already available so they wouldn't have to reinvent the wheel. And so they have now eliminated the vending machines. There aren't any sodas, there aren't any high sugar drinks, for like the juice and the Gatorade available, and now water is the drink of choice at the clubs. The Creative Living Center Adult Daycare. You heard Alice talk earlier about the importance of keeping our seniors active and healthy. Well, this program provides classes for stretching, flexibility, balance, low-impact aerobics, and strength training. And this was implemented for older adults at Creative Living Center and at the Greenville and Bethel Senior Centers. We are funding a program currently been known as West Greenville Garden Network. However, that's changing over to the Greenville Garden Network and also collaborating with Greenville Harvest. But 7 gardens were developed in the West Greenville area. Produce was provided to nearly 200 individuals. An additional 150 people were served through the Greenville Community Shelter, Intergenerational Center, 3rd Street School, and the Soup Kitchen. The Brody School of Medicine Food Literacy Partners Program trained volunteers to provide nutrition education, and as part of them taking those classes, they turn around and they provide community service back to the community in the area for nutrition. The Food Bank of North Carolina, we are currently funding the Mobile Food Pantry and the Fresh Produce Initiative. Nutritious foods and non-essential not food essentials were provided to low-income residents in Pitt County. Mobile Food Pantry distributed 430 pounds of food to their 8 different sites, and the Fresh Produce Initiative distributed over 905,000 pounds of fresh fruits and vegetables. Freedom Family Foundation It's a fitness and nutrition program including health screenings, healthy cooking demonstrations that was held each month on Saturdays, and they served 360 individuals throughout the community. The Little Willie Center after-school program, during that grant cycle, they utilized the program with community health ambassadors to provide health risk assessments for individuals in the community and the families that they served. Health education forums served 35 people, and also they had a biweekly food distribution to provide food to the community. The Greenville Community Shelter, we fund a healthy balanced nutrition program which provides breakfast for the residents. As you know, most of the residents, after they have breakfast, they need to leave for the day to hopefully be searching for jobs, that type of thing, unless I think it's a woman with a child and they can remain at the shelter. We also fund transportation to get them to vocational appointments, doctor appointments, dental appointments, and also some funding for after-school and summer activity programs for the children. Also during this grant cycle, we provide $100,000 for the capital construction of the new facility that is scheduled to open in June of 2015, and it's very exciting. I get these emails from Bob, every other week, and it's very, very exciting to see it come to fruition. And I shared with Casey Holland today that they should take before and after pictures of, what it is now and what it's going to be, because it's really going to be, it's going to be a nice facility. We fund two grants with the North Carolina Cooperative Extension Service. One is the Healthy Communities Expanded Food Nutrition Education Program, otherwise known as FNEP. It teaches families of school-age children about how to prepare healthy foods, food safety, physical activity, and also how to budget, how to budget their funds and how to use coupons and how to stretch maybe some of their food stamp dollars. Out of the 170 enrollees, 155 graduated, and nutrition practices were improved by 95% among those participants. We also provide funding for a community garden technician, and she provides gardening instruction to individuals throughout the community. Last year, they served over 1,700 people. They've got a great program across the street with Wintergreen, where the kindergartners come across the street, and very safely. They make sure they have that under control. But they cross the street, they come over, and it's like a classroom for them. It's an outdoor classroom for them, and they go through the whole thing of planting, harvesting, and it's a great program for those kids. And I think what it does is they tell their parents, Mom, I want to show you what we're growing over here, or, this is what's in the store. We need to get some of that. So it is planting those seeds, in their minds as well as in the garden. But Joni is a great asset because she provides, if there's a church that wants to start a community garden, any group, school, she's a great asset to the community. So if you all would like me to forward her emails, I'll be happy to. There's a program called Project Anna. They provide supplemental food, health, nutrition, education sessions, and health screenings for about 1,500 households. They have a strong partnership with the food bank. Last Friday, I had to leave work not feeling well, and I got a phone call from her. She was very excited. She called me on my cell phone to tell me about a new partnership they had with Walmart that was going to provide more fresh produce and vegetables to their program, so she was very excited about that. Operation Sunshine is a program for girls ranging from ages 5 to 13 years old. Funding provides good nutrition, physical activity resources for females in the after-school program. They serve 25 females during the regular school year and 55 in the summer. Total Christian Ministries has a program called Healthy Lives, Healthy Choices. They have lay health advisors that work with 45 African-American churches. During the past year, they provide 47 health screenings and to serve 451 people. They also have physician referral follow-up. They don't just screen and say, well, you've got diabetes or you've got high blood pressure. They provide some follow-up services and, make sure folks are enrolled with the primary care. They have had instances where they have to send someone to the emergency room because such a high blood pressure. They also provide exercise classes. They have 5 different sites and attended by almost 2,000 people last year. Talked about, you heard earlier about what Stephanie had to say about some of the programs they're doing, and Brain Injury of North Carolina partners with them. And then they also served 3,000 people through direct contact on trainings, referral services for those individuals who, are hospitalized and find themselves with a brain injury, and their life changes and their family's life changes. So they help them to coordinate those changes. The Center for Family Violence Prevention provided funding for a shelter care project. They were able to provide regular health education workshops, health screenings, nutritious foods, and they partnered with the health department to provide some of those services to 64 shelter residents throughout the year. The Real Crisis, a teen suicide prevention program. Funding helped provide counseling information, referrals, and trainings for suicide prevention and also suicide counseling. They also implemented anti-bullying messages to programs throughout the schools. Pitt County EMS had requested funding for personal protective equipment. Some of the individuals working with are women and talked about, how the equipment does not fit the same as does a man. So, and a lot of the equipment was worn out, so we provided funding for them to purchase equipment for 23 employees. There's an organization called Access East, and we had 3 grants with them last year. One is to provide a physician extender at the Bernstein Clinic. They provided over 6,000 patient encounters, and some of those services included 101 emergency follow-up appointments and 43 hospital discharge follow-up visits. So when they're seen in the emergency room or in their hospital, they're questioned as to whether they have a primary care physician. If they do not, then they are referred to the Bernstein Center. In the area of medication assistance, we provided funding for a part-time medication assistant position, and she is able to procure medications at a reduced cost and also some free medications. A social worker was hired for Project Mend to connect patients utilizing free clinics such as Oakmont, Greenville Community Shelter Clinic, and Grimesville Clinic with Health Assist and or a primary care provider such as Bernstein Center, and also to connect them to other safety net resources that are available in the community. CareNet Counseling East. Services were provided to uninsured and underinsured individuals for mental health counseling. 535 visits were made available to 181 clients through the community benefit grant funds. CareNet has a bilingual counselor enabling the organization to provide services to the Latino population. Pitt County government provided funding for a program called SOAR Program for the Homeless, which provided assistance with accessing disability benefits, establishing primary care medical home, and medication prescription assistance. There were 23 individuals that were assisted with referrals and services to include moving from homelessness to finding affordable housing, and referrals to primary care and resources for medication assistance. The Pitt County Council on Aging Medicare Options Counselor. Medicare's complex guidelines and benefits can leave beneficiaries at risk of maybe making a decision that they don't need to make, and so they provide counseling to individuals. Last year, 1,100 people were counseled, resulting in a savings of almost $1 million for Medicare beneficiaries. 328 of the individuals receiving counseling report income below 150% of the poverty level. Any questions?
Yes, ma'am. Can you refresh my memory as where the new community shelter is being built?
On the same site.
Same site?
Same site, because they had enough space on that property to build on the same site.
Thank you.
Any other questions?
Okay, thank you. Turn it back over.
The final area or for SOTCH is that we report any new and emerging issues that occurred within the year. And so through 2014, I think all of you know that we did have emergence of Ebola virus. The health department did monitor some travelers that came through our area. We also, there was a return of measles virus in other states across the country, and so we were monitoring, how close it was getting to North Carolina. It continues to be a disease threat to our society. And these outbreaks serve to remind us that it's critical that we have a good public health system in place to respond to these emerging threats. Continued budget cuts to local public health departments from federal and state budgets are putting our populations at risk of severe health consequences. And the final thing we left in the report to the state was public health's focus on prevention saves our tax dollars and protects our public from costly disease and disability. So that concludes the 2014 SOTCH report. We move into next steps. We're getting ready to start the cycle all over again. We are now working on the 2015 community health assessment. Over the past several months, we've been conducting numerous community listening sessions across the community. About 19 have been done. I think there's been about 280 individuals that have participated in those groups and have been giving us lots of great feedback about their opinion of our health priorities in Pitt County. There's also a community opinion survey that was an online survey that was been taken by over 500 individuals. So we're looking at secondary data, such as the information I reported earlier about the leading causes of death within our county and compared to our state. We're compiling all this information together, and we are going to report this at our Thursday's Pitt Partners meeting, where all of these group members will come together, plus several more members of the community are invited to come and hear all of this data presented. And then we're going to vote on priority areas that need to be addressed based on the outcomes from all of these sessions and surveys. Then, once these priority areas are selected, we'll be bringing those areas back to this board, to the hospital board, and to Pitt Partners for us to select new priority areas that we will focus on for the next 3 years, and we'll establish goals to see what progress that we'll be able to make over the next 3 years. And I think, Dr. Murray, you wanted to add something to this with the county health rankings, I believe.
Yeah, I just remind folks that we just gotten the new county health rankings report, and I spoke to the commissioners the other day and a few weeks ago to let them know that our ranking actually fell. Unfortunately, we're going in the wrong direction, and particularly in terms of health factors, we went from 34th in the state out of 100 to 44th in the state. So, and our goal as a community is to be in the top 20 by 2020. So that gives us about 5 more years to get that turned around and improved compared to the other counties in the state. So we've got a lot of work cut out for us here in the next 5 years. The other thing I just add, Amy, is we are looking at, we want to, once all this process goes through and we've picked these priorities, we then want to develop a community health improvement plan, and we hope to have a joint community health improvement plan with the board of Vidant Medical Center this year, and I think we can do that probably this fall. So.
Very good. Any last-minute questions for Amy? Well, I want to congratulate Dr. Morrow and Amy and all your presenters tonight. This was a superb set of presentations and very educational, and I'd like to challenge all the board members, including myself, to go back and think about some of the things we've heard tonight and bring some ideas to the next meeting next month. So.
And I'll leave you with contact. Of course, you have my contact information, but also Kristen Brooks, who is the coordinator for Pitt Partners for Health. Her number is up here as well.
Amy, well, I might just mention while we're on television that the Pitt Partners meeting is this Thursday, the 14th at 8:30 in the morning.
Actually, we changed it to 8 o'clock.
8 o'clock,
Yeah.
Thank you, at Alice Keene Park.
Public is invited to attend to hear the information that's presented from all that's been collected over the last several months, and help us to select areas that we need to focus on and bring back to these boards to address.
Very good. Thank you. Dr. Marr, Health Director's report.
I'll make it real brief, Mr. Chairman. Amy and I will be going to Raleigh this Friday to receive our accreditation certificate. I mentioned at last month's meeting that thanks to Amy and many other folks in the department, we scored 100% on about 150 criteria during our site visit in March. So we're very proud of that success, and we'll look forward to that meeting on Friday. The only other thing I would mention is the General Assembly is still in. I understand the House budget will be coming out probably at the end of this week or first of next week, and we expect the Senate's budget to follow pretty quickly. I think I met with the Health Directors Association last week. If things stay as they are right now, I think we're going to be okay in terms of local health department impact. but you never know what'll happen in Raleigh between now and the end of the session, so we'll keep a close watch on that.
Very good. Any questions for Dr. Morrow? Okay, is there any other business, any business tonight, or if not, is there a motion for adjournment?
So moved.
Is there a second? All in favor, say aye.
Aye.
All right, any opposed? Thank you very much.